Yes, a very good morning and many thanks for staying with us right here on NTV Uganda. My name is Romeo Busiku and I'm coming to you yet again with another pertinent conversation, largely focusing on the COVID-19 messages of hope. Well, COVID-19 is still ravaging many other parts of the world. I'm talking about 515.9 million to be exact cases of the coronavirus disease being registered, that is all over the world. Out of that number, the good news is that 470 million people have actually recovered. That is the good news. The sad news pertains to the fact that 6 million and some 272,000 people are no longer with us since they got infected with this heinous disease. You and I know very well that the US is still on top with the biggest number of all these cases owed to the coronavirus disease. 83.5 million cases of the coronavirus disease. Over 1 million and some 23,000 people have died within the US alone. One country alone, 1 million people. So we need not lay our guard down because COVID-19 can make a comeback in that regard. While India follows suit in second position with over 43 million plus cases of the coronavirus, 500,000 people have died within India. That's how debilitating the situation is. 523,000 people dying in India alone. And the third country being battered the most has to be Brazil with some 30.5 million cases of the coronavirus disease, and over 663,000 people have died within that country. Coming back to Uganda here, some 164,000 cases plus of the coronavirus disease have been registered, and over 100,205 people have recovered. That is the good news. The sad news pertains to the fact that 3,596 people have died and they are no longer with us. We have only 2 people who are grappling with this heinous disease in the hospitals within this country. Mulago National Referral Hospital has 1 patient who is severely ill, mainly because that person was never vaccinated. And also St. Mary's Hospital Lacho is also grappling with 1 person who's, ailing with COVID-19 because that person was never vaccinated. So we are here to compound on the significance of vaccinations because they really work. At this point in time, 19.8 million vaccinations have been undertaken within this country. 15 million people have received 1 single dosage of either vaccines on the market. And we also do know that 10 million have received all their dosages of the COVID-19 vaccines on the market. So what needs to be done so that we ramp up more vaccinations so that we cover the target, which is 22 million vaccinations in that regard. I do have Mr. Tadeo Atuhura. He is the Communications and Partnership Manager at Mount May, Uganda. He's not alone. You also do have Reverend Moses Semogoma. He is the Mitiana Health Diocese Health Coordinator, and he is here with us. Many thanks for joining us, Atuhura, and also Mr. Reverend Moses Semogoma.
Thank you. You're most welcome, Romeo.
Indeed. Glad to be. You were here on Wednesday. Of course, we had a conversation. We had Haji Abubakar right here with us from Luero, and he gave us an account of how they are fighting or grappling with COVID-19 within their area. He said they are winning the war, but there were some challenges that we did discuss. And of course, that's why Reverend Semogoma is here, the Mitiana Diocese Health Coordinator, to talk about the fight within your area. How is Mitiana, handling the fight against the coronavirus? Are we winning in Mitiana or are we losing? Good morning and welcome.
Thank you.
Indeed. Talk to us about that. Are we winning in Mitiana or losing?
Thank you so much, Romeo. I've been introduced. First of all, I want to bring greetings from Mitiana Diocese Church of Uganda.
My people over there.
And my Bishop, Dr. James Bukomeko, is listening and also sending greetings to fellow Ugandans. He has done a lot. And actually, he says even if they say 5 times, he is ready to go for all those jobs. Are we losing or are we winning the battle? I would strongly say in Mitiana Diocese, because we have 5 districts of Mitiana, Mubende, Chivoga, Chankwanzi, and Kasanda respectively, you find that partly we are losing and partly we are winning.
How so?
Because you find that there are some people at the moment who still complacent. I mean, they don't actually take SOPs as serious as they used to. And when it comes to issues of avoiding crowded places, you find that now people are being in crowded places. which is one way of getting more infections.
So you're telling us when the economy reopened, the people disregarded the use of the face mask or social distancing?
Definitely. And you are talking about the face masks. People are no longer putting on face masks. Very few are who do that. And when you look at the cost of a mask, 2,000, one could outweigh, can I buy a face mask at 2,000, or can I buy a kilo or a half of a portion so that I can feed my family? So such challenges are making the battle to be lost. And also another issue is the cost of soap. As we advance the issue of sanitizing, using soap, using sanitizers, you find that the cost of soap is limiting some people from hand washing because they have no money to buy soap. They look at it as a wastage of buying soap to wash hands when you are not going to eat. So that makes it difficult.
And indeed, I went to some of the pharmacies within this country, some of the reputable pharmacies within this country, and I was looking at the sanitizers that they had. A sanitizer that used to go for 3,000 Uganda shillings, the small bottles,
yes,
it's now 8,000 Uganda shillings. And I'm like, these are the tools that we need to fight the pandemic. Well, are they, you know, also being affected by the skyrocketing prices? Tadeo Atuhure.
Thank you, Romeo. And once again, thank you for the opportunity.
Is it true that the skyrocketing prices are affecting the ability of our people to adhere to the SOPs?
I haven't yet got the research or the statistics or done a study. But before I really even go to that, I would like to first appreciate Reverend and the Bishop for having really had a great partnership with us from Malmö, Uganda, to ensure that we have our lives of our people
since
saved,
last year.
Yes, through the COVID-19 messages of hope. And of course the partnership we have with the Ministry of Health and also with our partners, CDC and PEPFAR, ensuring that really lives are saved when this pandemic did strike. And the successes that have been registered greatly is because of this partnership with the faith leaders and this the very great partnership of COVID-19 messages of hope. So I'd like to appreciate really everyone. And also, Romeo, like we said, it's always good to celebrate. It's always good to celebrate what we have, achievements. You're talking about 2 patients. I remember last time we were here, during those dark days, it was about so many numbers.
Thousands were there,
Thousands. But now we thank God that the interventions that we talked about with the whole leadership, we've been able to move. At Malmö Hospital, we're still having the second kind of services where we offer vaccination, treatment for those that have come with those kinds of cases, and also above all even home care support through our hospital program. But you raised something very pertinent about, are we losing or gaining?
Indeed.
I really want to say that we are gaining. What we also need to do entirely is to see how would we continue consolidating the gains.
Indeed.
The Reverend highlights something very crucial. Even when I move around, you find that people have dropped the issues of the masks. And somebody was telling me, no, actually the ministry told us that we actually stopped putting on the masks. And then now there's an issue of prices of things going up, more specifically soap, just as Reverend has pointed out. But my take is this, Romeo. There are some things that are really a priority in life. Health is a very crucial area, that in terms of even where you have scarcity, prioritization is very crucial. And I think it's going to be our task at self-individual level, but even at community level, like we're already doing, to emphasize this message to our people, that it's very important that we are not complacent. The little that you have, you can be able to again see that we don't go back to the other situation. So getting to be vaccinated is very crucial. And this message going out is really very important for us. Have you been vaccinated? Even when the minister did say that, yes, you can have your mask off if you're 2 meters away, so long as you're actually also fully vaccinated.
Indeed.
That means you've taken your 2 jabs, if you did take AstraZeneca, or you even have a booster that you've taken. Now the question that we would have is, how many of the people have been able to take those jabs? It also means that if you haven't taken it, then you cannot put off your mask. But also looking at the kind of transport conditions, if you're in a matatu, for instance, you need to see the situation on the ground. How taxis are supposed to take like about 14 people.
Indeed.
In some instances, they even put in about 15 or 16 of them. Now you see how you've been squeezed. And then you say, can I put on my mask? or not. So it's really going to be about seeing the situation.
It's even upon you as a citizen to see a fully packed taxi and you say, no, I'm not going to enter this taxi because it's fully packed.
Yes. And we've seen situations...
And if people are not wearing their face masks, please don't enter the taxi.
Exactly. So it's going to be more of your personal responsibility. And I must say that all along, I remember when the president was opening up the economy, said everything has been done. We've given you the information. We've alerted you on SOPs. We've had the vaccines come. Now, of course, you know, the lockdown affects the economy. So if we are going to go back to our normal lives, we're going to have to live with the COVID-19. But we must live with it with caution to ensure that, yes, do I have my mask on? If I'm going to do my businesses, am I into social distancing, self-social distancing? If I get the symptoms, if I've got a flu or cough and I see these are symptoms of COVID-19, can I go to the facility? Can I go to Malmö Hospital and get tested and find out? But also the other aspect is, parties are on. We were just discussing with Reverend about stigma, where people are saying, no, I think for me, I don't want to talk about that thing. But it's a time for us to say, look, if you have COVID-19, if you suspect, then you do the necessary processes. But above all, Romy, I must emphasize, vaccination is the way to go. And it's to alert people, please, this is the time to go for the vaccination. It's great that the faith leaders are continuously doing this role. Every Sunday, I receive a text from a reverend telling me this Sunday I talked about this message to emphasize to people on the radios and everywhere. And I think that's one way we are going to have to achieve success. You've been enlisting statistics.
Indeed.
Globally, what's happening out there. Those that eased the lockdown and how things started again to turn around.
Indeed.
The India situation. So those are not best practices, but they inform us that can we be able to strengthen our efforts, double our efforts. And one of the ways that we're looking at, the partnership with the faith leaders is very crucial because they meet people every day. I don't know how many people have reached out to Reverend just this morning. Others are sick, others are having, say for me, a prayer, my children are going to school, there are those that are graduating. So a message from the faith leader is able to reach so many miles. And I think it's those partnerships that we need to augment already what the Ministry of Health is actually articulating out there. So for me, are we gaining? Yes, we're on the journey to gain. We only need to consolidate. Of course, it comes with challenges. Like, for instance, somebody will tell you, I think COVID is no longer there. But even before that, before we had those announcements, we had different situations whereby somebody would say, no, COVID is not even a disease, it's not there. Remember where we started, Romeo? Until when a message was given that, look, COVID-19 is a disease. It's available. And it's us to be able to fight it.
Indeed. And of course, we've seen some countries that had made gains had continued to lose to the coronavirus disease, China inclusive. There was a point when the Chinese were not having any patient within their hospitals and they were actually registering 0 deaths. But as we speak, they are registering between 374 to 500 infections on a daily basis. That's how debilitating the situation is. And in some parts, lockdowns are still biting within China. South Korea, another country that was winning, is now registering, they are now kept at 17 million cases of the coronavirus disease, and they are registering between 23,000 cases of the coronavirus on a daily basis. And the Japanese, who have their 8 million cases of the coronavirus, are registering between 21,000 cases on a daily basis. And the Australians, who are grappling with some 6 million cases of the coronavirus, are registering 38,000 cases on a daily basis. So simply because Uganda is winning, we give you this information to know that we are winning, yes, but elsewhere they are losing the gains that they had actually started boasting of. So that's why we are here with the COVID-19 messages of hope. Let's talk about complacency with Reverend Moses Semugoma. How have you been able to fight this problem within Mitiana?
Definitely with continuous engagement, as Tadeo has mentioned, because we always have people. From Monday to Sunday, we always interact with people, church events, funerals, weddings, parties, and other things. So we always tell people what's happening and what is going to happen if they don't behave the way we used to behave during lockdowns. And the funny bit is when you look at these two cases we have in Mulago and Racho, people think they are far away from Mitiana, they are far away from Mumbalala. But even within our communities, there are people with symptoms. And you know what it means? Tadeo mentioned about stigma. Some people even still have that stigma. They don't want to come out if they have cough, so they tend to treat themselves. And, and now our major emphasis is on encouraging people to go for vaccination, because preventive strategies are always the best. If we can prevent, then it's better. And if people go for vaccination, you are talking about the 19 people being vaccinated, but can we have that 22 millions vaccinated if we are, and we can make it.
And then we start looking for other people. That we missed out on.
And again, if we are to be vaccinated, then it means that if you are vaccinated, again, you don't want to say, since I'm vaccinated, everything is okay. We also need to put on our mask, because that's the recommendation. I'm vaccinated 2 times, but I again need to have my mask, and it is
because you can still get infected.
Because I can get infected. And this is the issue we are trying to address as faith leaders. And also another issue is we are encouraging outreaches.
I see.
Because when you talk about vaccination, and some people say we don't have money for transport, we're engaging the local authorities, the district task forces, to have nearby sites where they can have people vaccinated. And we have seen this working, because you find that people think this is now their own way of life, because the service is nearer them. And now when you look here, we are planning to have a celebration as a diocese for 45 years.
I see.
We are expecting to have over 20,000 people
has to be there
at Mitiana Cathedral, Church of Uganda. You'll find that such messages cannot be left out. We can't leave out encouraging people to have vaccination, and actually we are planning to have a vaccination site there, because it is an opportunity for us to bring health services nearer to people who come to. And also we are saying those who come to attend should have their masks, should have their sanitizers, or if we don't have sanitizer, we have a provision for soap and liquids there, so that they are able to observe the SOPs. Now, this is what is majorly we are doing. And also, when my brother Tadeo did say, we are partners in development, we are partners in building our country, because we need a safe country where people can live and live a meaningful life. We have been supported by Maudme Uganda to have radio programs on our local radios in Mitiana and also in Mubende. And we have different religious leaders speaking about these messages of hope, and also bringing the message back home that if we don't really do what we are supposed to do, we are more likely to go back to like China. China lost the battle because people thought they had won. You know how China was affected earlier. You know how we are affected. And it is not even difficult for us to go if we don't do what we are supposed to do. And the Bible says actually that if people don't do what they are supposed to do, that they are non-believers. Because we are supposed to behave what God wants us to. In John 10:10 he says, he came that we may have life. We cannot have life unless people do what they are supposed to do.
And indeed.
Professor Maswa once said, life is made at home and repaired in a hospital. This is exactly what is happening. We should have life in our home, at individual level, at household level. Let's observe these SOPs. Let's go for vaccination as individuals, as families. So at the end of the day, if my family is vaccinated, your family is vaccinated, Tadeo's family is vaccinated in the village, then that village is safe. And we are speaking the same language.
Ladies and gentlemen, boys and girls, let's not grow complacent because we might see a resurgence of the COVID-19 disease and the COVID-19 lockdowns are like. Yes, it is so hard right now for you to go out there and make money with the skyrocketing prices on commodities and fuel and so forth. So think about how life would be so difficult under a lockdown and with skyrocketing prices. So what we need is for the economy to stay fully open and for you to continue adhering to the SOPs, wearing of face masks, and when you are in a hot concentration of more than 5 people, you need to be socio distancing. 2 to 3 meters are enough for you. And when you get to public transport, please ensure that a face mask is on your face, covering your nostrils and also your mouth. The sensitive spots are not going to be inhaling those COVID-19 pathogens, and in that regard, the economy shall be fully reopened and we shall continue with our lives. Let's talk about the issue of language barrier. On Wednesday this same week with Haji Abubakar, we did discuss the same issue. So many of the people have not been getting these COVID-19 messages of hope simply because of the language barrier difficulties. Is it still a problem within Mitiana, Reverend Moses Semugoma?
It is, and we are trying to address it because now some of the messages of hope are in English.
Indeed.
And when you look at our communities, most people don't understand English. And what we are trying to do is speaking to them in different languages. Because we have different pastors, we have clergy, faith leaders who can speak very good Runyankole, who can speak very good Ruchiga, who can speak Swahili. So we are using a multiple language approach so that people are able to understand these messages of hope. Yes.
And indeed, there is Reverend Moses Semugoma, the Mitiana Diocese Health Coordinator. He's not alone. We also do have Mr. Tadeo Aduhura, the Communications and Partnership Manager at Mount May, Uganda. Do not forget, over 515 million in some 900,000 plus cases of the coronavirus disease have been registered on the whole global scale. 6 million and some 272,000 people have died. The good news, 470 million people have actually recovered in that regard. Let's take a brief break. We'll be right back with more of the COVID-19 messages of hope right here on NTV. Many thanks for staying with us right here on NTV Uganda. My name is Romy Busiku and I'm here with Reverend Moses Semugoma, the Mitiana Diocese Health Coordinator. He's not alone. He's also with Mr. Tadeo Aduhura, the Communications and Partnership Manager at Mount May, Uganda. We are here to talk about the COVID-19 messages of hope. Yes, we are winning the war against COVID-19, largely owing to the statistics that are on the ground. Only 2 patients within Mulago National Referral Hospital and St. Mary's Hospital, Lakshore. That is good news. But then, because of those statistics coming out, many of our citizens are growing complacent, thinking, well, we have won the war against COVID-19. And that is the biggest mistake that was done by the UK, Japan, South Korea, China, and many of these other countries that have seen an exponential increase in the number of COVID-19 cases. We are here because we do not want to fall into the same footsteps of those countries with these COVID-19 messages of hope in that regard. But also, let's discuss the policies, because the Health Ministry on the 27th of April came out and they said, well, if you are fully vaccinated and you want to come to Uganda, you do not need to present a 72-hour COVID-19 test. And if you are also a Ugandan and you are fully jabbed and you want to go to the UK, to the United States, you do not need to present a PCR test 72 hours before leaving this country. But then recent revelations actually point to the fact that even those who are fully jabbed or even with boosters can still get COVID-19. A case in point is the Vice President of the United States, that is Kamala Harris. She was COVID-19 positive, but guess what? She is fully jabbed or vaccinated, and she also did receive her booster. Think about a Kamala Harris in the US or China that who wants to come to Uganda, and that person is not required to present a negative PCR test 72 hours before they board that airplane. It means they'll bring the disease to our country before even knowing. So the policies, are they working to our advantage or disadvantage? Let's explore that with Tadeo Aduhura and also Reverend Moses Semugoma. Let me start with you, Tadeo Aduhura. What do you make of this policy coming in from the Health Ministry? Do you think it's going to actually undo the gains we are actually boasting of right now? The fact that vaccinated people can get COVID-19 and we are allowing them to come minus a PCR test.
Thank you, Romeo. I think I want to trust that the ministry, by the time they come up with the different policies, they have been able to do an analysis deeper in terms of thinking just beyond the disease, the other factors as well. that are able to ensure that we have a continuity of living with COVID-19 as well. And you point out something concerning somebody who is already having tested positive to COVID-19 and linking it to the vaccination as well. And I want to say that getting vaccinated doesn't mean that you cannot actually get COVID-19.
Thank you.
The only difference is that when you are vaccinated, you don't go to the level of severity. So in ensuring that as you're coming in, we must look at also the other aspects as well. And I'm talking about people who come in the country and they're living. You might be looking at individuals, but some of these people are bringing in business into the country, which finally is able to contribute towards our economic development, general our economy where we have been. So I think it's more of how can we then have our own people follow the SOPs as guided by the ministry, get to be vaccinated, because you're not going to have a lockdown which also then affects our economy further. So I want to believe and trust, because they have led us throughout this war, and by the time I remember, we were told clearly that even with the president, he said we're going to relax gradually based on two scientific analysis. Now from the surface it may look that it's going to be tragic to say you don't have to provide to have the mandatory testing of 72 hours before you come into the country. It may look on the surface that it's going to be quite bad. But from the analysis, we're talking about
and it will even increase vaccinations.
Yes.
People will be like, oh, if I'm fully vaccinated, I can go to the US.
We've got now 19 million who have been vaccinated.
Indeed.
Our target is 22 million.
Indeed.
Now, if we just increase that and have it really, everyone getting vaccinated, that would be a great resource. And I think for me, I want to take it from that perspective, that can we have many people vaccinated? Because once you have many people vaccinated, then you're free to be able to interact. Of course, the other perspective is we've seen situations whereby even outside, where the churches are opened up or places of worship, and people still have maintained virtual connection. So even if that policy is there at that, there is that thought in you of saying, no, am I really fit to travel? But if you must travel, then you're going to have to follow the following things. So I want to trust Minister of Health, because they have really been able to lead us. And I know by the time this came up, there is a clear analysis of what would have for the pandemic. But my emphasis is, you who is watching us today, Romeo who is here with me, can we be able to take the personal initiative of making sure that we're observing what we have been directed? Again, linked to just that. Look at how the minister actually said, you can have your masks off. But then it's clawback in nature. He said, no, look, you can have your mask off if you are in 2 meters. But also the other aspect is you must have been fully vaccinated. So it's about you looking at the situation. Have I been vaccinated? The other aspect is, if I'm boarding a taxi, for instance, and realize that we are about 18 people in that taxi, and we are squeezed, do I remove my mask? Of course not. I maintain my mask. The other aspects within that, because I listened to the minister clearly, there are so many other details, including looking around and saying, am I into a busy place? Can I do my own social distancing? But what about if I see the symptoms? What do I do? The hospitals, and that makes me really, really excited that we still have the facilities to deal with any person who presents with COVID-19 symptoms at the facilities. When you talk about this one patient in Mulago Hospital, and he is being looked after, I think that is very critical. We don't have to say, no, everything is relaxed. The hospitals are now doing other things and that kind of thing. No, still you can go to the hospital, have symptoms, access a healthcare service, and then you're helped. You can still go for testing. It's also there for COVID-19, but at the same time, the vaccines are available. So we still have to make sure we are focusing on those guidelines as per the Ministry of Health.
Irrespective of the challenges, I'm still sure that we are winning against this war. You know, on COVID-19, only 2 patients in the whole country. Remember a time when people were being treated on the verandas of Mulago Hospital? That's how heinous the situation was. They even had to send some people back home so that they could be treated from their home states. That's how heinous the situation was. Reverend Semugoma, give us your 2 cents on this issue of the policies that do not warrant our citizens who want to go to these outside countries to present a negative PCR test, or those who want to come to Uganda, as long as they are fully vaccinated, are not required to present a full PCR test 72 hours before. Do you think this is a good move?
Thank you so much, Romeo. My take on this is, as my brother Tadeo has mentioned, the issue is not on the PCR, the issue is on vaccination. If we all get vaccinated, then other issues will remain constant. And when you look at the numbers, if Uganda vaccinates, Kenya vaccinates, and other parts of the world vaccinates, as we are all required, because this is a standard strategy. And if we are all to embrace this strategy of vaccination, then other factors will come in.
Reverend Semugoma, here's the challenge we are having as media practitioners, because we are seeing a problem here when they do not let these people, you know, present a negative PCR test 72 hours before. Why? Many people are faking the COVID-19 vaccination cards. Someone can come with a full vaccination card, but it is fake. So we could have this person board the airplane, but this person is having COVID-19. So to us, those are some of the challenges we are seeing with this directive. But as you and yourself, what are some of the challenges you're seeing with this moving forward, and also within Mitiana Diocese when it comes to combating COVID-19?
Now, when you look at faking the cards, that's unhuman. And if people start engaging themselves in such, actually
selfish moves.
That's being selfish. That's being selfish, because if you know that you are not vaccinated and you make a fake card, then you know you are going to associate with the people you are going to kill. That's being selfish. And what we should encourage is all checkpoints should do their work, because
to verify.
Because if I'm to travel from Uganda to for example, Rwanda, how many checkpoints do I go in? I don't really base on Uganda checkpoint, but as I move different checkpoints, I'm being checked. And if I'm found that my PCR is faked or my results are faked, then my vaccinations affect. It means that they have to deal with me, because that's now being, I don't know what term I can even call it. That's being someone who is not serious with his or her life. Because life is between you and death. If you don't respect your life, then nobody can respect it. And if we are all to be vaccinated, other policies, even if they make policies, like now we are saying all school-going children are eligible for vaccination, which is very right. And if we vaccinate them, the chances of getting severity if they get the disease are limited.
And the Health Ministry is kicking off that exercise on Monday. That's the good news.
Which is good news. And if people say, I'm going to see my medical practitioner and I get a 4D card so that my student is allowed, and the government is saying it is not going to be forced. It's optional. But it is up to you as a parent to ensure that your child is safe. The only way that child can be safe is being vaccinated, because the child is going to associate with our colleagues at the school. Now, I'm leaving here. After this program, I'm going to UCU. We have Save the Mothers Reunion Conference.
I like that.
And I'm going to be part of it. But most of our colleagues are going to attend virtually. It doesn't mean that when we have policies, people will not actually behave like policies say. Some people do against the policies, but it is between you and your God. That's why we always emphasize being faithful. Faithful and integrity. That's integrity. If we say, if you are to travel, you must be vaccinated. And if you do vaccinate, the chances of coming back with the disease are there, but the chances of being highly infected are limited.
Indeed.
This is exactly...
Be hospitalized.
Yes. Now, it is so bad to have people lining up for medicines for diseases that we can control. That's where we are losing the battle. You saw how many people died because they could not afford medicines.
Indeed.
But if we have free vaccination, then why should we fake for cards?
Indeed.
The vaccines are safe. The vaccines are free. The vaccines are real. We have tested them. I always said this. I was vaccinated. My wife was vaccinated. My wife was vaccinated with Sinovac. I vaccinated with Pfizer.
Indeed.
And we are all safe. And we are actually saying, even if we get another chance, we are ready to.
Booster.
We go for booster. We are ready.
So that is one of the challenges we've, highlighted as the media practitioners when it comes to these policies. Now, in your locality as Mitiana Diocese, what are you seeing as a challenge that is impeding this fight against the coronavirus disease, Reverend Semgoma?
Now, the issue of, because now it is now between the location. Some people look at these policies as they don't affect them.
I see.
And sometimes we look at these policies as not useful. But the policies are good because they shape the community. And when you look at this policy, actually, it is strengthening, behind it is strengthening the issue of vaccination. Because if we vaccinate, then you find that even if I'm coming from Mitiana, I'm able to move. If I'm coming from Chankwaza, I'm able to move freely. If I'm coming from, my person is coming from Korea, is coming to Uganda, is able to reach me, and we interact safely. Because I'm vaccinated, he's also vaccinated.
When we were interacting with Haji Abubakar on Wednesday, he told us that lack of facilitation or meager funding towards, the fight against the COVID-19 pandemic has made it so hard for them as the Muslim community to, battle against this COVID-19 pandemic. Is it also a challenge when it comes to financing in Mitiana?
What I could strongly say is funding is limited, and actually we have never had enough funding.
I see.
Because even the Ministry of Health is low funded.
I see.
And you saw what happened to our budget, health budget. Now, what does this mean? We have space. We can always encourage people to use. Because if we have space as faith leaders, I always say we have space from Monday to Sunday. This space is free, it's God-given. We can speak about these issues without being paid.
Indeed.
But the only thing that we need to be supported is if I'm to come to Kampala for such a TV show, I need facilitation. If I'm to move to supervise how facilities are doing, how outreaches are conducted, if I'm to move from my home and I need access, I need financial support, that is where I need support. But first of all, I repeat this and I'll continue to say it, even if we have money, even if we don't have money, we need to do this work because our work is a calling.
Indeed.
Our work is a calling. I'm here. How many Ugandans are benefiting from my call? They are listening to me. I'm not paid. Actually, today what Tadeo pays me is to giving me space to come and so that I can reach out to many people. So if they are to support us, we need financial support. But we should not make financial support because we don't have financial support and we limit people to get services. We should mobilize people to go for the services even if we are not financially supported. Despite the fact that we also need finances because it is blood, but we need people more. We need people to have life. And they cannot have life when we have not spoken to them.
Indeed.
Let's speak to them and we leave the rest to God.
Indeed.
Now I've come. God is going to bless me.
And indeed.
He's going to bless me because many people are listening to me. Because as people get good life, they are praying for me. How I wish that man continue to live.
Indeed.
So that he makes sense to other people's lives.
Indeed.
This is exactly what we are getting.
Indeed. Do anything you can in your small mind to continue disseminating the messages of hope when it comes to the coronavirus disease. Meager funding shouldn't be an impediment when it comes to spreading of awareness on this very, very bad disease, COVID-19. In your small mind, go out there, talk to your neighbor, yes, about the importance of wearing a face mask and also social distancing. It is really important. Let's also bring in, that is Mr. Tadeo Aruhura, the Communications and Partnership Manager at Mildmay, Uganda, and we talk about your experience with the faith leaders when it comes to combating COVID-19. Entice us with those details.
Thank you, Romeo. I just want to appreciate Reverend.
Indeed.
I think Reverend represents all the teams that we work with, the faith leaders really, and I think it was a great strategy for us, or it has been a great strategy for us to work with the faith leaders
Indeed.
in carrying this message, because like, you know, faith is about hope. It's about love, it's about sympathy, it's about influence, it's about really making sure that the message is all roundly packaged to reach and change people's attitudes. And I must say that we've had great impact in terms of having worked with the faith leaders. And up till today, they still continue to carry on the message. Like Reverend has said, it's a special calling from God to save lives. And like I quoted that actually life is from God, and God gives us to us, it's us to preserve it and make sure that we're actually saving so many of these lives. Our experiences has been that it's sustainable, one, it's really impactful, but at the same, it's also authentic, because, you know, in message change, in changing people's attitudes, we need to have the message carriers. The message carriers who are really, really, really trustable. Now, like I have always told you, Romeo, and I know you, Romeo, as well, you have got that special faith leader who touches you, who talks to you. They talk to us, not only from the mind perspective, but also spiritually. And you feel that I think I need to make sure that this is changed. But also, one of the things that we've been able to tap into is that they live with the people, they live with us on a daily basis.
And they don't wear any political colors.
No, they live with us every day, and they influence us every day. Already Reverend is telling you there is a great celebration that's going to happen in the diocese.
45 years.
On 28th of May, this month.
So I was really humbled to see, even when we were doing orientations and the feedback meetings with the faith leaders, the bishops, we thank so much the Bishop of Mitiana. He was the first to arrive for the meeting.
I see.
And said, this is something that we need to make sure that we are championing. So how many of those people is Reverend talking to?
Why do we actually single out these religious leaders? Could it be because the politicians are not believable?
No,
more like the religious leaders are more believable, the fact that they do not wear any political colors?
Actually, when you look at the whole fighting the pandemic for COVID-19, every person was on board.
I see.
And the politicians did their bit. But also remember, politicians also come to the faith leaders. If they have won the elections, they call the faith leader to pray.
To call for peace.
Call for peace. Where they went not a good situation, they also call the faith leaders in the different categories. So we've also worked with the politicians as well. When we're having our meetings down even outreach areas, we work with the chairman of C5s, we work with the technical people, the district health officers. So it's really a multi-pronged approach. But what we want to emphasize is with the faith leaders is that there's always a point of reference. Like I was just saying, I cannot have an audience of more than 100 people at a go. I don't know how many Reverend had last Sunday. He's going to have more this Sunday. The other Sunday, he's actually talking to people on a daily basis. But there are also these other special connections. There could be women groups, many groups that are within our own church setting, the mosque setup, that really we can be able to reach out to, and they change the perspectives of the community. I will tell you, Romeo, even if I went down to the ground and I am talking to these groups, and Reverend also says, please, I also need to talk to you, and starts with a prayer and then talks to them. The message from the Reverend is going to go direct.
Well, of course, the religious leaders are so affected, and I would like to borrow a little from the fight against HIV.
Exactly.
It was very hard to believe the politician, but when it comes to the pastor, the bishop of the church, it was so easy to believe them. So, meaning even with the war on COVID-19, when it comes to the adherence to the SOPs, wearing of face masks and so forth, people have been able to listen to the religious leaders. When we're talking about vaccinations and the politicians were handling the whole drive of awareness, the vaccinations were low. But when we got Semugoma on board, Haji Abu Baker, Ramadan, you understand what I'm trying to tell you. We saw an exponential increase in vaccinations, 19.8 million right now, only 22 million, and we shall have hit the mark.
Exactly.
Go ahead.
And so that helps us. And I just want to look at this because the COVID-19 messages of hope is, like we said, it comes to an end. We stop at some point.
Yes.
But the messaging continues. That's the sustainability part of it. In other words, wherever I am not, Reverend is there. And Reverend is talking to people. Like he said, he's going to hold it and say, look, you need to check this. Yes, I have come to you, Reverend. I want you to pray for me. I don't feel fine. Maybe it's a spiritual thing. But then Reverend says, you're coughing, you're having this. Could it be that actually, have you tested for COVID-19? Can you access this service? We had situations whereby people were saying, no, look, we want the leaders to be to be vaccinated first. I remember when the Archbishop was vaccinated, everyone said, wow, so the vaccine is safe. Reverend here was vaccinated, like you said, with a wife. So many followers looked at Reverend. Have you been? We had the sheikh for
same experience.
I was there, and once he actually put his hand and he was vaccinated, and everyone started lining up. So the major point, Romeo, is that who are the message carriers in this?
Are they
exemplary? That is so crucial for our COVID-19 messages of hope. The other aspect that we have is that when you get COVID-19, it's not the end of the world. No. What earlier was coming up that once they have told you COVID-19, you are finished. And even people...
More like HIV back in the day.
Exactly, and people started stigmatizing each other. So they would be able to say, look, no, Romeo, I don't want to associate with you even when they come back. But Reverend and the rest of the team have demystified that. So our best practice that we've learned from COVID-19 messages of hope and working with the faith leaders is that, one, you have your trusted message down to the right people. You have got the good people to carry the message. You answer the sustainability question. But the faith leaders are continuously going to be able to have a platform to carry on this message.
Reverend Semugoma, in less than 2 minutes, we'd like you to give us some recommendations that my people who are watching NTV Uganda right now could go away with when it comes to ensuring sustainability, continuity, when it comes to combating COVID-19. What ought to be done moving forward?
Thank you so much, Romeo. First and foremost, I want to say the SOPs are still crucial as we used to have during the lockdown.
I agree.
We should observe the standard operating procedures. Hand sanitizing, face masking, avoiding crowding. This is key, but also another recommendation is having all Ugandans vaccinated. Because that's the way to go. If we are vaccinated, we are able to pick up from there. People have lost their lives. Families are still struggling. I told you we buried in Mitiana. And I remember one of our clergy attending a funeral when they are burying, and it was a terrible incident because as they were getting out of the casket, it fell down. And all people who had turned up there started running away. And this is the clergy who stayed alone, and because he had to bring hope. People thought that they are going to be all infected. And this is still happening. People still have stigma, but we should always tell people that's not the end of life.
If someone has recovered, they've recovered, don't discriminate.
They have recovered, no discrimination. And we should love them. We should be compassionate. We should do provide to them if we have what to provide to them.
Just like we did with HIV.
Just like we did to HIV. And another way we can overcome this is supporting one another. Because if you are able to support, you do support.
Indeed. Reverend Semugoma, he is the Mitiana Diocese Health Coordinator. Thank you so much for having made the time to speak to us. Tadeo Adhura, in a minute, can you give us your parting shots before I let you go?
My parting shot, Romeo, is very simple. Well, let's follow the guidelines from the Minister of Health, our leaders. Let's ensure that we are all getting vaccinated.
Spot on.
Please kindly come at Maldmay Hospital. We are testing. We have an international accredited laboratory. So you can test not only COVID-19, but even others. Please also for treatment, we thank Wakiso District for the vaccines. Whenever we have vaccines, please, let's get vaccinated. It is our responsibility, and we can be able to win COVID-19.
Mr. Tadeo Tuhura and Reverend Moses Semugoma, thank you so much for having made the time to speak to NTV Uganda on this very pertinent subject. And thank you too for having watched NTV Uganda from 11 a.m. up to now when we are concluding this conversation. And my message to the government, please, there was one distribution of face masks. We need to be talking about another distribution of face masks for our people within this country. Many can't afford the face mask. Like Reverend Semugoma was saying, it's going for 2,000. So we should think about redistributing the face mask, and it should never be a one-off because people need these tools. And that's it for this conversation. I'm Romy Busiku. Have yourselves a blessed day.